Good evening, Facebook community. This is Jennifer with Uplifting Life Naturally, hopping on here for a brief message, talking a little bit about, continuing my topic about ticks from last evening. We talked a little bit last evening for those of you who hopped on about, some signs and symptoms and what you might expect to see. If you missed that live, just, hang tight a little bit later on here this evening. I'll be posting a blog that will have some written information as well as the video from yesterday attached to it as well. So what I wanted to talk to you about today is, so we've identified that we, have a tick bite. Now what do we do about that besides panic? But actually, really, there's no real reason to panic with it. What you want to do is, certainly anytime you're out and about in areas that are at a higher risk for ticks, such as, wooded areas, high grass areas, shrubs, that type of thing, whether it's you or your pets, make sure that you're checking, your skin as well as your children and your pets upon coming inside. So if you would happen to identify a tick that has attached to the skin, what you want to do is just get a pair of fine-tip tweezers and take the tweezers and actually, try to get it as close to the mouth of the tick as possible. You want to make sure you avoid grabbing it from the belly portion of the tick because that's where, they have their, the diseased fluids and such. And as you would squeeze, in the belly area, you could potentially even put more of that diseased fluid into your skin. So always make sure that you're trying to remove it by the mouth. It is recommended, if at all possible, that you use some gloves. They do say as an alternative, you can wrap your hands in some tissues or paper towels. I personally have never had to remove a tick, but, for as small and tiny as they are, I can't imagine trying to do that with gloves, let alone, paper towels or tissue. But just passing that recommendation on, as that was something I had seen in the literature. I would imagine, however, cleaning your hands just with soap and water afterwards should be fairly sufficient. And that's what I would do anyways. So anyways, once you, get it removed, you certainly want to make sure that you cleanse the area just with some warm soapy water. Nothing fancy is needed. You can apply a little bit of bacitracin ointment after the fact if necessary. Some people, feel or have heard that, applying some type of petroleum jelly, even fingernail polish I read, can't say I've heard of that one before, and even some rubbing alcohol to a tick before removal is good. However, that's actually not recommended. So, you do not want to use the rubbing alcohol, fingernail polish, the petroleum jelly, and I even saw a lighter. Now, I don't know, maybe some of you guys have heard of that. I can't say I have or could even imagine that, but those are things you do not want to do. And the reason behind that is using those types of, liquids and agents over a tick that's already, attached to your skin can actually cause it to embed further, into your skin deeper, making it harder to remove and even increasing your risk of, disease transmission. So, that's, pretty much basically it. It's pretty simple to, or so they say. The procedure is pretty simple. I don't know, maybe some of you guys have had to remove ticks, and I would imagine maybe it's not as simple as it seems in literature, but that's what they say. And then just certainly, keeping it clean, watching for signs of infection. If you would notice any significant redness, any pain, swelling, pus drainage, fevers, anything of that sort, certainly make sure you're seeking medical attention for infection. And then from there, you certainly want to make sure that you're observing for later signs and symptoms that may indicate, transmission of diseases, as, ticks very commonly can transmit Lyme's disease, which is the most common in our area here in the Pennsylvania area. Now, as far as our pets, we can, our pets can also have ticks as well. So, you want to make sure that you're checking them also when they're outside, in the grass and, or out in the woods or wherever, your pets may be. Removing a tick from a pet is pretty much the same as that, on a human. Use the tweezers and grab by the mouth and, kind of pull up directly. I did read that sometimes the ticks can break at the neck and can be embedded, that the mouth remains embedded into your pet, but they claim that that's okay. either way, I mean, I guess you can always check with your vet if that's the case. But, pretty much, you do the same thing. You can observe for, signs of infection. They even say you can apply a little bit of like bacitracin ointment, to your pet as well. And really the only big difference I had seen as far as between, transmission of disease in our pets compared to that of humans is, humans, it does say that typically the tick has to be embedded into our skin for about 36 hours before the risk of transmission of Lyme's disease increases. With a pet, however, it's only 10 hours. So a little more, time sensitive, I guess you could say, with our pets. So bottom line, tick season, summer season here is upon us. Hopefully we have the nice weather that we can all be outside enjoying. Just check your skin, check your kiddos. Clothing, also if you're out in those wooded areas and such, what you might want to do is even just throw those in the dryer, on high heat for about 15 minutes upon coming in. That way, if there are any ticks, on there that maybe you didn't realize, you can, certainly kill them off that way. So hopefully this is helpful, a helpful message to you. I see a lot of people have hopped on. I certainly appreciate all of the support. Again, I have not gotten good enough at catching all of the people hopping on to do individual, hellos and comments, but I certainly do appreciate it. If there's any questions regarding, my message or any questions that you have, certainly feel free to drop those in the comments below. If you think others can benefit from this message, please share. And as I mentioned before, watch for a blog a little later on tonight that will, talk, kind of incorporate my message from last evening, some symptoms to watch for, as well as, a recap of what I've just spoke about here today. So I hope everybody has a nice rest of the evening, get to bed early, another new day tomorrow, and I will be on tomorrow. My plan tomorrow is to talk about Lyme's disease. So see you then. Bye.